Can you tell which one of these women have chlamydia? No? Well, neither can they. In fact, any of the women shown here could be infected with chlamydia without even knowing it, as it is deemed the silent killer for its lack of symptoms. Although the beauty of Appalachia is often unparalleled, its rural landscape and isolation from the more modern metropolitan areas cause disparities in the care that its populations receive. Access to care is not only limited by location, but also by its culture. According to Winter's rural nursing theory, rural Appalachian women practice self-reliance, the capacity to care for one's own needs, and usually they wait it out to go to the doctor unless something really bad is bothering them. Just as in urban populations, adolescents make up the majority of cases of chlamydia in rural Appalachia. These teens report being more sexually active than their urban peers. They engage in sexual relations at an earlier age and become pregnant 33% more than their urban peers. Not to mention the abundance of poverty, food insecurity, mental illnesses, and substance abuse behaviors in rural Appalachia that definitely contribute to high-risk sexual behaviors. Recommendations for screening for chlamydia are pretty similar. The USPSTF recommends that all sexually active non-pregnant young women aged 24 years or younger and older non-pregnant women who are at an increased risk be screened annually. ACOG recommends that all sexually active females aged 25 years old or younger and women 25 years old and older with increased risk factors for chlamydia should be screened annually. The CDC also recommends all sexually active women under 25 years of age and sexually active women aged 25 years and older at an increased risk should be screened annually. The best evidence-based practices for decreasing the incidence of chlamydia include treating patients in the office with 1 gram of azithromycin, as one study found more than 30% of patients didn't even fill their prescriptions after they had been to see the doctor. Another way to help decrease the incidence is to use EPT, or expedited partner therapy, which is legal in most states. Providers can write extra prescriptions for their patients to give to their partners that may have also been infected, without ever having to see them for an appointment. Of course, one of the best practices is screening for chlamydia with the NAT test. And instead of asking patients if they need to be screened for chlamydia or other STIs, adding it to their routine test takes away the shame and anxiety. And last but not least, educate, educate, educate. Many women are still unaware of the long-term consequences that chlamydia can have on their reproductive systems. And promote condom use every time.